Namaskaram. I'm Dr. Sudeepta Rao, consultant physician and functional medicine certified practitioner at Yashoda Hospitals. This rainy season brings in a lot of relief from the summer heat. But along with the summer heat that is dissipated, we have a rise in infections. As a practitioner who believes in preventive care, I think that this is not just a challenge, but an opportunity. An opportunity to increase our resilience from within. The infections that we usually see could be mosquito-borne, like malaria, dengue, chikungunya. They could be food or waterborne, like gastroenteritis, hepatitis A, and typhoid. They could also be respiratory illnesses, especially in elderly and children, and people with predispositions like asthma and allergies. Even though we hear a lot about external hygiene, which is of paramount importance, we should also be aware that our inner resilience and systems and immunity can help protect us from these infections. So what can we start with? We can start with, surprisingly, your gut health. 70% of your immunity lies in your gut. Did you know that? So eating seasonal foods which build your immunity, like ridge gourd, bottle gourd, antioxidant-rich fruits like jamun, pomegranate, and papaya, herbs and spices that can be included in your day-to-day food like garlic, ginger, turmeric, even tulsi, and spices like cumin and ajwain, which can aid in digestion and also have antimicrobial properties. Foods which are fermented like curd, buttermilk, and even ganji is very good for your gut microbial diversity. Another important factor that we often forget is mood and movement. Along with cloudy skies come gloomy despair. So there is reduced movement and reduced mood. What do? We have to make sure that we have increased activity even if it is indoor. Try and get as much sunlight as you can, even near a window if possible, which will increase your vitamin D levels, your sleep rhythm and circadian rhythm gets back to normal, and your immunity is improved. Other things that are commonly forgotten: please don't eat stale food or leftover foods which is more than 24 hours old, especially when it comes to meat and rice. Try and reduce your processed and refined foods. Make sure that you're aware of mold and fungal growth in this damp, humid environment. Bread which is moldy or musty, throw them away. Keep your food dry in a dry container. Make sure that you don't eat raw, uncooked food, especially from street vendors. And clean water is always advised. So disease doesn't start with exposure to one germ. It also starts with your body's inability to prevent it from happening. This rainy season, this monsoon, make sure that you focus on your gut health, eat seasonal foods, move regularly, and be mindful. Prevention, I believe, comes from your daily routine. The small decisions that you make every day to make sure that you work towards your health. Also, if you do get symptoms, despite taking precautions, make sure you contact your doctor as soon as possible. Thank you.
Like, comment, and subscribe for more health updates.